and what we do. The Arizona Developmental Disabilities Council, or ADDPC, or the Council, we go by a lot of different names because our full name doesn't exactly roll off the tongue. We are a federally designated state council on developmental disabilities, and we are in existence because of the Developmental Disabilities Assistance and Bill of Rights Act of 2000, otherwise known as the DD Act. You've probably heard of the DD Act. We are charged, just like all of our 55 sister agencies across the United States and all of the US territories, with doing systems change advocacy to support individuals with intellectual and developmental disabilities. And that takes many different forms. That takes the form of direct advocacy and outreach to policymakers, whether elected officials or appointed officials. It takes the form of education in communities around the state. It takes the form of supporting projects through grant funding that assist individuals with developmental disabilities or further our knowledge about ways to support self-determination and independence for individuals with intellectual and developmental disabilities. There's a lot more to it as well, but just to give you a sense, we are a federally funded and federally designated entity. We operate within the state, the state system in the state of Arizona, but we are in many ways autonomous from the state and have a lot of freedom to pursue our advocacy activities as a result of that. Now, we have a limited time today to talk about the legislative overview for both the state legislature in Arizona and for the 119th Congress. So I don't want to waste a lot of time. I want to dive right in. I will tell you that because we have limited time, we probably will not be able to get into a huge amount of detail about a lot of the issues that I'm going to share today. And I'm going to be sharing with you information on a relatively small number of bills we're tracking here in the state of Arizona. Right now, our list is almost 80 bills strong, but we don't have time to go into all of those. So I'm going to highlight a few of the ones either that we feel very strongly about because they will do good, or we have some concerns about. And if you want more information about our legislative tracking list, about the legislative tracking we do and why we do it the way we do it, please feel free to contact us. You probably have our contact information, but if not, my information is at the end of this slideshow. So we would welcome your input, welcome your questions anytime you would like to get in touch with us. Either Jason or myself would be happy to talk with you at length about anything that we're doing. Just to kind of spell out the landscape that we're looking at right now in Arizona and in the nation. Here in Arizona, we have, well, what we would consider an entirely new legislature. Now, there are a lot of people in the legislature, both in the House and in the Senate, who are returning from prior terms. There are a few people who've moved from one chamber to the other, from the Senate to the House, from the House to the Senate. But because all of these folks were elected in the November election in 2024, we consider it to be a new legislature. Interestingly, in the Arizona legislature this year, the Republican Party controls both chambers. That has been the case for approximately 20 years here in Arizona. It might be a little bit more than 20 years. The Republican Party has controlled both chambers of the legislature. What's interesting this year is that the Republican margins have expanded in both chambers. In the prior session, in the Senate, it was a 16-14 split. It's now 17-13, 17 Republicans, 13 Democrats. In the House, in the prior session, it was 31 Republicans, 29 Democrats. It is now 33-27. So to some degree, the Republicans serving in both chambers have a little bit more leverage, a little bit more power than they had, and a little bit more security. If one or two of their members disagree with a particular bill, they can probably still push those things across the finish line. In Congress, at the federal level, there are a lot of new changes. Now, we would consider the House of Representatives to be also a new House because all of those members were also elected in the November 2024 election. But to be a little more pointed, there are 63 totally new members of the House of Representatives in DC, only 9 new senators. But here again, the Republicans control both chambers, both the Senate and the House. And this is a switch in the Senate. The Republicans were in the minority in the prior session of Congress. They now have a 53-47 advantage in the Senate, and they have a 220 to 215 advantage in the House of Representatives. That's actually a smaller margin than they had in the prior Congress. It's a little bit tighter in the House, which means that if Republicans are trying to get a bill across, they have fewer votes they can lose in order to maintain their margin. In addition, you may have heard, we have a new president in the White House. It was just inaugurated earlier this week. If you're not aware of that, we have some news articles we can send your way. It's important to note the presidential administration because in every case, whenever there's a new presidential administration, there are new priorities that are going to be pursued. In this case, there are some substantial, truly meaningful, and not always meaningful in a good way, proposals on the table that could dramatically affect disability services, as well as a lot of other human services across the United States and in the state of Arizona. I'm going to dive into a few of those as we go along, but that just kind of gives you a sense of the landscape. What are some of the key issues that we're dealing with here in Arizona? Well, when it comes to the disability system, we're always dealing with questions about system funding. The system in Arizona has been, we would say, chronically underfunded ever since the Great Recession of 2008, 2009, and some massive cuts to the system funding that were made by the Arizona legislature at that time in order to balance the state budget. Now, to be fair, disability services were not the only area that were cut at that time. Lots of other things were cut from the state budget, but we should point out that disability services have really never recovered from what they lost 15 years ago. We're also dealing with massive caseload growth. Arizona has one of the largest numbers of new enrollees in DD services of any state in the country. People continue to move to Arizona because Arizona's DD system is seen as a model for many other states. We are consistently ranked at or near the top in not only the range of services provided to individuals with developmental disabilities, but also the quality of services provided. So a lot of folks moving here, a lot of folks being diagnosed that weren't diagnosed before. And in particular, it's fair to say the autism diagnoses are one of the key reasons why caseload growth is as strong and as large as it is. There are also issues with network adequacy. Arizona, as you probably know, has only two major metropolitan areas, the greater Phoenix area and the Tucson area. Outside of these two areas, we would primarily consider the state to be a rural state. Now, there are some large communities. There are Flagstaff, Yuma, Kingman, a few others with relatively large populations, but they are nowhere near the size of the Phoenix area and Tucson. And as a result, the networks of providers, the network for healthcare are not nearly as strong or nearly as robust in those areas as they are in the metropolitan areas. And that is a challenge when it comes to DD services. There are also issues around health and safety. I just mentioned the healthcare. Healthcare for people with intellectual and developmental disabilities is, it's a challenge. It's difficult in Arizona and nationwide because there are not enough trained professionals, clinicians, who understand the needs of people with IDD and are able to provide appropriate services for them. Once again, there's a larger number in metropolitan areas like Phoenix and Tucson, and there's a much smaller number in those outlying areas. And then issues of safety. As you probably know, we have been dealing with issues of abuse and neglect around individuals with intellectual and developmental disabilities for a number of years, going back to the Hacienda incident of 2019 and even predating that. We continue to deal with those kinds of issues. And I'll talk about some of the work that's being done, some of the legislative proposals around safety for people with IDD. And then finally, and this is not an all-inclusive list, but the final thing I'll touch on today is adequate transition planning, transition implementation, and employment opportunities for individuals with IDD in the state of Arizona. system has improved. Opportunities have expanded tremendously, but we still have a long way to go. And this is an area where ADDPC works really tirelessly, I would like to say, in order to provide greater opportunity, in order to make communities aware of the opportunity for them to find employment for people with developmental disabilities and provide them meaningful work, competitive, integrated work in those communities. At the federal level, there are some slight differences. Not that any of those issues I mentioned at the state level aren't important at the federal level, and there are initiatives being undertaken and proposals on the table to address some of those things. But there are some very different challenges at the federal level. One is that there's a vastly greater number of competing priorities at the federal level because you're dealing not with a state of 7 or 8 million people, but with a nation of 300 million people and 435 House members and 100 senators, all of whom are trying to represent their districts or their states and bring to the fore the issues that are important to the people they represent. There are also, because we have a new administration initiatives to combat a variety of things, to deal with a variety of things, to in some cases do away with a variety of things that many of us might find important. And the administration does not always agree with what we have to say. And then more than anything else, there is the federal budget. We have a massive federal budget. Unfortunately, a huge percentage of that federal budget is taken up by mandatory funding programs like the Department of Defense, Medicare, Social Security, a variety of other programs. And so the percentage that is considered discretionary income is relatively small. And there are efforts underway. If you've been paying attention to the news in the last couple of days, you know there are already efforts underway to make massive cuts to the federal government in order to save the government money and in order to pay for some other priorities that the current administration has that are not necessarily the priorities of the Biden administration. So we have to deal with all of these things and many others. Again, I'm giving you really a high-level overview, but you can see there is a distinction between how the federal government views certain things and how state governments view certain things. Among the things that are being dealt with in Arizona, and I've got quite a few bills here, but I'm gonna kind of blast through a few of these. We kind of have broken down some of these into various categories. There are and have been for the last few years a number of proposals related to elections and voting rights, voting processes, the way elections are conducted. Much of this stemmed from the controversies related to the 2020 election, where there were people who did not believe the election results were fair. They believed there was some kind of corruption or malfeasance in the way that the election was conducted. And so starting in 2021, and continuing until today, we've seen quite a large number of election-related or voting-related bills in the Arizona legislature. Now, why is this important to the DD population? It's important because more and more individuals with intellectual and developmental disabilities are voting and wish to vote. And by and large, anyone who's not under a legal guardianship that prevents them from voting has the right to cast a ballot. We see it as one of our responsibilities at the council to protect that right. And we work with our partners at Disability Rights Arizona and a variety of different other disability advocacy organizations to ensure that people with IDD have the greatest possible access to the ballot box. And so when voting rights issues come to the legislature, we always look at them to make sure they are not going to in some way disadvantage people with disabilities. Among the ones that have caught our attention this year are House Bill 2005, which would require that county recorders automatically place a voter in inactive status if the recorder feels that there is something incorrect, improper, or illegal about a voter registration. Now, the interesting thing about this bill is it doesn't require that the recorder reach out to the individual to make sure that the information is correct. It leaves it up to the recorder to make the determination about whether or not something has been done improperly, and then to automatically place that person on the inactive inactive voter rolls. We see that as a process that could potentially disadvantage people with disabilities. Similarly, there is a proposal by Representative Colliden to limit the amount of cure opportunities that people who cast absentee ballots could potentially have. And if you're not familiar with this, when an absentee ballot is submitted, if the county recorder's office or the election officials feel there's something wrong with either the signature on the ballot or something about the ballot that could be corrected prior to election day, they will reach out to that voter and ask for that person to do what's called a cure, to correct whatever's wrong with it, or to prove that they did in fact sign the envelope. Things like that. When cure opportunities are taken away, it offers people less of a chance to exercise the franchise, to exercise their right to vote. And it concerns us because people with disabilities can easily be disadvantaged because they are not always as they don't always have the communication opportunities or the communication tools that they might need in order to take advantage of a cure opportunity. Similarly, there is a ballot or an initiative related to, or a bill, I'm sorry, related to early voting lists, requiring that any ballot returned to a county recorder as undeliverable would automatically cause that voter to be placed on an inactive voting list and taken off a permanent early voting list. Similar kind of instance where somebody is losing the right to vote without having an opportunity to make sure that something didn't go wrong with the system, that something didn't improperly get returned. So these and a number of other election-related or voting-related issues are on our radar for the current legislative session. There are a number that relate to education as well. Now, you'll see a couple of slides from now, we have some issues related to safety. And the first couple of bills under the education topic also relate to safety, but they relate to safety on school campuses. And at first blush, a number of these bills may look very good. And in some cases, they would be very good for students with disabilities. There is a push to improve safety standards, improve emergency operations planning, improve the ways that school safety personnel interact with students with disabilities, and ways that schools provide better safety plans in the case of an emergency so students with disabilities have their needs taken into account. We looked very closely at these bills in order to make sure the House Bill 2022 concerns us because it allows for, well, it allows for, in simple terms, more guns on campus. It establishes a new safety program that allows local schools and school districts to hire school safety personnel and establish school safety programs that would be, nominally anyway, approved by the Department of Education, but without any real guidelines provided for what those school safety programs could contain. And so we're not saying necessarily that this is a bad initiative, but we're looking very closely because in addition to allowing for more armed personnel on school campuses, it doesn't anywhere in the legislation list a need to take into account the needs of students with disabilities. Now, Representative Gress's House Bill 2074 does in fact mention students with disabilities and does in fact require that new assessments and new school safety proposals include students with disabilities in the planning for school safety programs. We see that as a win for students with disabilities, and it's an extension of a bill that passed last year, Senate Bill 1315, that requires all public school emergency operations plans to take into account the needs of students with disabilities. But that's a limited range of planning that's specifically emergency operations plans. It doesn't include other types of school safety plans. So we're looking very closely at those bills as well. There is a bill from Representative Carter that would require schools to do a better job of communicating with parents who request that the school district do an evaluation of the student. In some cases, schools refuse to do evaluations. In some cases, schools take far too long to do evaluations. So this bill would require that there be better communication, an explanation of why an evaluation might be refused, or an explanation of when it will take place within a specified time frame after the parents have made that request. And then another proposal by Representative Gress related to emergency response plans and taking into account the needs of students with disabilities, specifically focused on charter schools who were exempt from the bill that was passed last year related to emergency operations plans in other public schools. So a number of education bills. Moving on to health and safety. There's a very controversial bill, and a bill like this has been introduced for a number of years now related to what we would colloquially call assisted suicide. In legislative vernacular, it is end-of-life decision-making. We don't take a position on this, but we know that the issue of assisted suicide or end-of-life decisions is one that it includes many different perspectives in the disability community. Our concern is that if a bill like this does move through the process, it includes safeguards so that individuals with intellectual and developmental disabilities are not taken advantage of, so that they don't lose the right to have a say in decisions made about their own lives. We know that the history for people with IDD has not always been a bright one when it comes to their bodily autonomy, when it comes to decisions about determining the course of their lives or ending their lives. And so we want to make sure that the bills like this do not take away the right of people with IDD to have a say in their own life decision making. There is an interesting bill, House Bill 2330, Representative Willoughby brought forward this year, related to being able to designate on your license, driver's license application, or your car registration application, or both, or on non-driver related state issued IDs, to somehow indicate that you as an individual have what is being used in the legislation, or what is being termed in the legislation, a communication impairment. This would essentially allow people to designate on their state documents that they in some way need to be approached in a different way than a typical driver would be approached by law enforcement. If, for example, they're pulled over for a traffic violation or for an inquiry. There are multiple perspectives on this. The important thing to note is that this would be a totally voluntary program. There would be nothing required of a person with IDD, with autism, to designate on their license that they have a communication impairment, but it would be an opportunity for law enforcement and for individuals to inform each other in certain ways, or mostly for the driver or the car owner, to inform law enforcement that they might need to interact with them in a slightly different way. We've seen a history in Arizona and elsewhere of some pretty awful interactions between law enforcement and individuals with IDD because of a lack of knowledge of issues around IDD. It's not an indictment of law enforcement. It's just a reality that sometimes people with IDD, sometimes people with autism do not respond in certain situations the way a typical individual, person without IDD, would respond. This would be a way of enhancing communication between the two. And it would be totally voluntary. And there would be nothing on the driver's license or on the car registration tag that would indicate to any other member of the public that the person has any kind of disability. It's an interesting proposal. It hasn't gone anywhere yet, hasn't been heard in the House, but it is likely to be. It has been assigned to the Public Safety essentially the Public Safety Committee, and will probably be heard in the near future. There are also a couple of bills around behavioral health and secure mental health facilities. The reason we look at bills like this is because often individuals with IDD have co-occurring mental health challenges, and too often, historically, individuals with IDD have been placed in mental health facilities without proper communication to their family members, without proper planning for their transition out of those facilities or their release into a step-down facility so they can be reintegrated into communities. We want to be very careful to make sure that proposals like this do not in some way just create more beds so that individuals with IDD can be locked up when their conditions might be misunderstood. We think there are good and appropriate and effective community-based settings where people with IDD and behavioral health challenges can receive the care they need. And so we look at bills like this very carefully to make sure, again, they're not going to disadvantage the IDD community. Finally, I want to talk about one last bill. It's a Senate Bill 1106. This bill was introduced last year, passed through the House and the Senate, and was eventually vetoed by the governor. It's nominally being termed Ava's law. It it expands the penalties essentially for public entities who could be considered to have not done due diligence in their hiring practices to ensure that an individual they hire does not have a criminal record related to sexual offenses. And if they didn't do their due diligence and that person then commits a sexual offense while employed by the public entity, that public entity can be held responsible for failing to do its job prior to the hiring. There are, again, multiple perspectives on this. The House and Senate last year thought it deserved to be passed. The governor disagreed and it didn't pass, but it is something that we would encourage people to look at. It is likely, I would think, to move through the process again and land on the governor's desk. We'll see how she rules on it this year. One of the interesting things about this law, and you'll notice that Senator Miranda, I'm sorry, has introduced a number of bills around behavioral health and mental illness. She has become something of a champion in the legislature for mental health issues. She's one of the few who has evinced an interest in learning more about mental health challenges and the needs of people who have behavioral health diagnoses. Also interesting, and you'll notice on these slides, I've put an R or a D behind the name of the sponsor. That's because we have Republicans and we have Democrats, and the Republicans are in control. So it is sort of a truism in the Arizona legislature that typically the bills sponsored by the majority party are the ones that have a greater likelihood of moving through the process. In this case, it's my opinion anyway, that Senator Miranda's bill on her Ava's law bill is likely to move through the process, despite the fact that she is a Democrat sponsoring the bill. We'll see, but it is one that is certainly worth giving a look. Perhaps most important for people with IDD and their caregivers is the issue of eligibility for services and then the performance of those services themselves. There are a great many bills, more bills than we anticipated in this year's session related to eligibility and services. House Bill 2174 is perhaps the most interesting of those because it would really fundamentally change the way people apply for services in Arizona. It would allow individuals to completely bypass the DDD application process. It would allow people to go directly to Altex and apply for Arizona long-term care system services without going through the DDD screen. As you probably know now, if you have applied for services, if you're receiving services, if you're a caregiver for somebody who receives services, the DD screen can often eliminate people, can often deny people access to Altex services before they even have a chance to apply directly to Altex. This would change that. So we'll see where this goes. Many people see this as an advantage and see this as eliminating a certain degree of bureaucracy. Others think that the DDD screen is an important one. We'll leave it to you to decide how you feel about this, but I would encourage you to read the legislation and get familiar with it and form your own opinion on it. There are other bills, as you can see. The House Bill 2182 would require that any Altex pre-admission screening would take into account cognitive impairments and the cognitive and intellectual needs of individuals who are applying for services. There is a proposal by Representative Gress to change the way applied behavioral analysis or ABA services are paid for. It would do away with the rate differential between in-home ABA services and facility-based facility-based ABA services, so that all services would be paid equally. There are some people on the ABA side, on the autism services side, who see this as pretty detrimental and likely to eliminate the opportunity for many people who are receiving in-home services to continue to receive those services, even if there isn't a facility in their vicinity or conveniently located near them to go and receive those services. So doing away with that rate differential could actually be a disadvantage for a number of people receiving ABA. Representative Willoughby has introduced a bill to provide $15 million in additional provider increases to access for this year. If you know anything about the Arizona legislature, you know that historically, take this with a grain of salt, this is personal opinion, historically, the Arizona legislature is pretty stingy. And so any bill that comes before the legislature that has a price tag attached is going to get additional scrutiny. $15 million in the scope of a nearly $19 billion, $18 billion state budget might not seem like a huge amount, but it doesn't matter. Any bill with an appropriation attached, with a price tag attached, is going to get additional scrutiny. So we'll see if this bill moves through the process. Even if it manages to get through the House and the Senate, it probably will not land on its own on the governor's desk. It probably will get folded into a larger conversation about appropriations and ultimately in the appropriations bill that will be issued toward the end of the legislative session, and the budget that will ultimately be signed by the governor. We'll see where it goes. Certainly $15 million is not everything the system needs, but it wouldn't be nothing. So there's probably a lot of hope that appropriation will move through. And then I'm going to skip through to what's really fundamental to remember, and it's really related to what I've just been talking about. Disability services cost money. We all know that. They're enormously expensive. They cost a massive amount of the state budget. They cost a massive amount of money for the federal government. And so whenever we talk about services, whenever we talk about home and community-based services, kids care, regional behavioral health authorities and behavioral health itself, parents as paid caregivers, all of these different programs, they cost money. And most of that money is paid for out of the federal Medicaid system. I'll talk a little bit about that as we go along. Here's what the governor is proposing. She just came out with her budget proposal last Friday, and here's what she's proposing to serve individuals with disabilities and other vulnerable adults in Arizona. She's proposing a $6.7 million general fund ongoing allocation or appropriation, and a $270,000 general fund one-time appropriation for the adult protective services system. Now, we see this as really important, again, going back to the issue of health and safety for individuals with disabilities, as well as other vulnerable adults, in light of the sexual abuse and sexual misconduct issues that have been we've been dealing with for the last 5 years or so. Then there is a large appropriation for the area agencies on aging, which serve aging individuals, including aging individuals with IDD, and then an appropriation for pre-admission assessors for Altex and the elderly and physically disabled community, EPD community. All of these appropriations, if approved, would make a very nice difference for the systems that utilize these funds to support Arizonans with disabilities, or Arizonans who are aging, or who are both aging and have disabilities. I would ask you to bear in mind that these are the governor's proposals. These don't automatically take effect until the legislature's had a chance to weigh in and decide what it thinks is appropriate. But on the IDD side, on the Division of Developmental Disabilities Services side, more importantly, the governor is proposing some one-time and ongoing support for provider rate increases that are desperately needed because, as you know, Arizona has seen a number of minimum wage increases in recent years and a number of increases in costs simply to do business as a DDD contracted provider. And state appropriations have not always kept up with those increased costs. So for fiscal year 26, the governor is proposing roughly $24 million in pay increases for DDD and AZIP, Arizona Early Intervention Program providers, closer to 25 million in fiscal year 27, and then a little over $25 million in fiscal year 2028, for a total of 74 million, almost $75 million in provider pay increases over the next 3 years. Bear in mind, these are simply to provide increases in provider reimbursements. This is not the overall budget for DDD services. It's also important to bear in mind, as has been pointed out by the provider community, that as generous as these proposals are, they don't even keep pace with the latest minimum wage increase that took effect on January 1st, and for which there was no special appropriation from the legislature to allow providers to keep pace with those increased wage costs for their employees. So nice show of support by the governor's office for the DD service system, but still not nearly what the system needs in order to continue providing services at the high level that we've become accustomed to in Arizona. And then this slide shows some ongoing, some larger budget proposals for the larger DD service system and services for DD to accommodate DDD caseload growth over the next couple of years. You'll see a number of abbreviations here. And I should point out, GF, of course, means general fund. That's money that comes from state revenues that would then be invested in the various service systems. And EA is basically the matching money that would come. It's expenditure authority is what EA means. It's the matching funding that comes from the federal government. Our Medicaid system, many of you probably know, is a federal-state partnership, which means that the state commits a certain amount of money and the federal government matches it. In our case, for every $30 the state spends, the federal government gives us $70 more. We have a 70-30 or 30-70 split, depending on how you want to look at it. We have one of the more generous, what's called FMAPs, or federal matching amounts in the country. And that's the formula is all based on the rate of poverty, or the rate of primarily the rate of poverty within a given state. Historically, Arizona has had a fairly high level of poverty. That rate of poverty has gone down in recent years. So our FMAP has gone down a little bit. It used to be 5 years ago, it was closer to 75%, but it's now down to about 70%. But you can see that any investment by the state is going to generate more than 3 times as much money from the federal government into our system. So the more the state can put in, the more we can draw down from the federal government. These are progressive proposals by the governor. They would make a significant difference in the DD service system, but again, they are not nearly what the system needs in order to keep pace with the rising costs of doing business in our state. And then, of course, we have to look at what's going on at the federal level. I alluded to some of this earlier, and some changes in priorities by the federal government, by the current administration. This administration has made it very clear that it wants to reduce government spending, that it wants to eliminate programs that it deems to be unnecessary or wasteful or otherwise not an appropriate use of taxpayer dollars. Now, there are a lot of arguments about why this administration feels so strongly about reducing expenditures in a lot of discretionary areas. Remember, there are certain areas, certain programs where they can't make cuts. They are obligated to spend certain funds on those programs. Services for people with disabilities are discretionary. So a lot of cuts could be made in this area. There are a lot of other areas that are discretionary as well and could see cuts as well. Medicaid is one of the key targets because it is so vastly expensive on a federal level. And unfortunately, it serves so many people that it costs a lot of money to serve them. But this administration has made it one of its tasks to target Medicaid and make as many reductions in the Medicaid funding system as it possibly can. Why does that matter? Well, again, for every dollar the state spends, we get more money from the federal government. And so Medicaid supports most home and community-based services in Arizona. You'll have to forgive me if I'm telling you things you already know, but we are constantly surprised by the number of people receiving DDD or all-tech services who do not understand, who don't know that those are Medicaid dollars paying for their services. And that's why it's so important for us to maintain and sustain the Medicaid system at the federal level so that state supports can be maintained and sustained right here in Arizona. The Arizona Healthcare Cost Containment System, a lot of people don't know that is our Medicaid agency. That is the agency that takes Medicaid dollars and then allocates them to different programs around the state for health insurance, for DD services, for a whole variety of different things that right now are supporting more than 2.5 million Arizonans. Obviously, that's not the number of people with IDD who are getting support, but without those dollars, people with IDD would not be receiving the services they are receiving. And the Division of Developmental Disabilities is essentially a subcontractor to Access, utilizing those Medicaid dollars to provide the supports and services that individuals with IDD need around the state of Arizona. So it is this federal-state partnership. And if one side of the partnership breaks down, it impacts everybody who receives services through that partnership. The range of programs that Medicaid dollars support for people with IDD is vast. It's not just habilitation. It's not just attendant care. It's not just day programs. It includes housing. It includes personal care. It includes physical therapy and occupational therapy, a wide array of programs that are supported by those Medicaid dollars. It allows people to get medications and get their healthcare services on an ongoing basis. And so it is crucial that we understand the range of Medicaid services, the range of involvement Medicaid has in the lives of the IDD community, and support maintenance of the Medicaid system around the nation and here in our state. Right now, it's under threat. I don't think it's too grand a statement to say that in this Congress, there are proposals that would detrimentally affect the Medicaid system and as a result, the ALTEX and DDD systems in Arizona. Among the proposals are block grants. If you're not familiar with block grants, that's where each state gets a certain amount of money to spend on Medicaid services, no more. And if it reaches the maximum that it's given, it has to find another way to support individuals in the state, or it needs to just deny services to the individuals in the state. Per capita caps or lifetime caps, similar to block grants, except that it goes down to the individual level. The state gets a certain amount to spend on each recipient of Medicaid services, or over the course of that person's lifetime, a certain amount that can be spent on them. And once that cap is reached, they're out of luck. There could be work or training requirements instituted in order for individuals to receive Medicaid services, and that could impact the disability community. Many people would not be affected by that, but it still could affect many people who are deemed by system administrators to be capable of working and therefore should be working or receiving training to work. It could also affect caregivers for individuals with disabilities, taking them away from the ability to provide appropriate care for that person with a disability and forcing them to go to training program or work, again, detrimentally affecting them. It could also simply include vast reductions in the amount of federal money that is given to the Medicaid system and less money to be distributed among the 50 states. So we are truly concerned about these proposals that are on the table, because literally tens of thousands, well, millions of Arizonans would be affected by overall Medicaid cuts. Cuts that would affect the disability community would touch the lives of tens of thousands of individuals who either have disabilities or are caregivers for individuals with disabilities. We could see for the first time in Arizona explicit waiting lists for services because there's less money to pay providers. There's less money for those services to be provided. Right now, our system, because of the particular waiver we have, the particular agreement we have with the Centers for Medicare and Medicaid Services, we are not allowed to have explicit waiting lists. There may be times when people have to wait for services because services aren't necessarily available in their geographic area, but that is not a true waiting list. We have not yet seen the kinds of lists that exist in other states where 10, 20, 30,000 people or more are waiting for services and sometimes wait a decade or more to receive those services. We also could see services either dramatically reduced or simply eliminated because the dollars are not there to pay for them. So what does all this mean? This means that we as advocates at the council, but we also turn to you as members of the community, we need to be reaching out to improve awareness of what Medicaid means to people in our state, what Medicaid means to people we provide care for, we advocate for, we live with, we love. We need to be educating the community, and in particular, our policymakers, our elected officials, on why Medicaid is so important. The cuts that are being proposed could take effect immediately and could be staggered out over the long term, so we could see immediate reductions and then ongoing reductions in the money available to the service system. What we need to do is educate our policymakers. We have a new Congress. There is a lot of ignorance, and I don't mean that in the worst possible sense. I simply mean that just like our legislators in Arizona often don't know about the needs of people with disabilities, our legislators at the federal level often don't know about the needs of people with disabilities. They often don't know anything about how the Medicaid system works. We need to educate them. So people need to understand what home and community-based services and Medicaid funding generally do for the IDD community now, and how devastating it would be for individuals who receive services, but also for our economy to see massive cuts and the unemployment that would go along with that, the number of providers going out of business. There are more than 50,000 direct support professionals working in Arizona right now. Imagine if even half of those individuals lost their jobs, what it could do economically. If providers went out of business, what it does, what the ripple effect is for other businesses that provide them with goods and services. It could have a truly devastating effect on our state's economy and on state economies around the country. So we are encouraging you to reach out to your legislators, your legislators at the state level, your federal elected officials, to let them know why Medicaid and Medicaid home and community-based services, long-term supports and services are so important to the IDD community. Many of them don't know even who a Medicaid recipient is. There are lots of misconceptions about who receives Medicaid. We have lots of information we can share with you to help prepare you to make a phone call or write a letter to your elected officials. Please don't hesitate to reach out to us if there's anything we can do. And we and our advocacy partners around the state will continue to be providing education opportunities and outreach so that we can collectively make our voices heard. How do we affect public policy? It's a simple word: advocacy. We make our voices heard. We speak up. We let our elected officials know what matters to us, either as individuals with disabilities or caregivers or advocates for people with disabilities. We reach out to them. We don't have to be, we don't have to be the most eloquent people in the world. We just have to tell the story of why this matters and what a horrible impact we would see if Medicaid dollars were taken away from the disability community. So one of our advocacy, or among our advocacy priorities in the coming year, is to build a stronger network around the state of Arizona to make the voice of the disability community even stronger than it is now, to speak out on issues at both the federal and state level, to educate our elected officials about the needs of our community and educate them about the impacts of their decisions, good or bad, on people with disabilities. And this is not just funding. This goes to all of the other areas that I've talked about today: education and safety and employment and a whole host of other things. But we need to make our voices heard. They need to understand why this community matters in Arizona. And we would like to organize and include you in our organization to speak out on these issues. We hope you will join us. We hope you will be willing to make calls, be willing to write letters or send emails to those who represent us in the halls of the legislature. Simple steps you can take. You can sign up to receive our newsletter and our other advocacy alerts. As Jason mentioned at the beginning, you can sign up to receive our legislative updates, which we produce throughout the course of the legislative session, the state legislative session. You can also find that on our website, the ADDPC website. That will keep you abreast of where things stand in the process, what is moving through, what is stalled, what is not likely to get any traction. And then, of course, you can always contact us if you need more information. We want you to speak about these issues with the people you interact with. Even your family members, your friends, your associates, your coworkers may not understand the importance of these issues to our state and to the people who live in our state. And as I've said probably too many times, reach out to those you voted for. Reach out to those who represent you. Even if you didn't vote for them, they represent you. Let them know what matters. And if you feel so bold and there's an issue that really strikes you, that really resonates with you, consider testifying at the legislature when a particular bill is heard in committee. Anyone has the right to testify. Anyone has the right to have their voice heard. So just a quick wrap up of some of the other policy priorities. I've talked about quite a few. There are others that we look out for all the time here at the council and would be willing to work with you on if you have a particular issue that you'd like to deal with. Obviously, Medicaid, home and community-based services are truly fundamental to what we do and what the disability community in Arizona does. Protection from abuse and neglect and exploitation. Healthcare, making sure that healthcare for people with IDD is what it needs to be to provide them the highest possible quality of life. Education and transition, I mentioned that before. Employment opportunities. Advocacy and self-advocacy, self-determination, things like supported decision-making, using supported decision-making in their lives to make decisions for themselves and guide the course of their own lives, and then future planning, making sure that individuals with disabilities and caregivers plan out what they want their future to look like so they can make that a reality in their lives. Thank you very much for listening. I would be more than happy to field any questions you have. I appreciate you sticking with us. I've talked at quite some length, but we do have some time left. If there are questions, I will throw it over to Jason or Sarah if you want to field some of these questions, and I'll do my best to answer them. I would also say there are other sources of information. I certainly don't claim to be the font of all knowledge about disability issues. We can certainly direct you to folks in the provider community, to folks at Disability Rights Arizona, folks who work for the universities and do research in this area. Whoever would be appropriate to help you get your question answered or your issue addressed, we are more than happy to connect you with those folks. So, Sarah or Jason?
Yes, thank you, John. Just a reminder to folks, we have our survey in the chat. I know a lot of people have been asking questions and making comments, so thank you for your continued participation. Since we have a bit of time here, let me pull out a few questions that I think several people wanted a little bit more questions about. Ruthie was asking, how about better training for school personnel, understanding mental health and DD behavioral issues? So this goes back to the state legislation you were talking about. Anything on the horizon regarding mental health or behavioral training for staff at schools?
As a matter of fact, there is a proposal in the legislature this year. I'm trying to look at it on my list here, related to establishing basically an academy for school counselors and school social workers to help provide better mental health training and help them make them help them be better at what they do. There would be an appropriation associated with this, so again, it would face a bit of a tough road in the legislature, but there is a recognition, I think, that we need better mental health services at the K-12 level. And so there is at least one representative who is thinking along those lines and willing to put a bill in front of her colleagues or his colleagues to make that happen. I apologize. I'm trying to find it here and I don't have it right at hand, but if you want to contact us, we'd be happy to provide you more information about that, give you a little more information on the legislation that's being proposed.
Thank you. Next question. So Lindsay was asking about mandatory training for police and firefighters. Some more than just a PowerPoint. She says most employees have to do onboarding and annual vector training on sexual harassment. Forgive me, Lindsay, I do think this had to do with maybe the abuse and neglect stuff. I'm not positive. Anything to say on that, Jon?
We've been fighting for a number of years now to try and increase the amount of training that law enforcement officers get around interacting with folks with disabilities. There are a lot of voluntary programs. There are some modules that law enforcement officers can look at voluntarily when they do their annual recertifications. We would like to see not only increased mandatory training while they're in the academy, but then increased training on an annual recertification basis. We've not had success so far. We attempted pre-pandemic to get that training instituted, and we met with opposition from certain members of the legislature. Some of it has to do with the availability of time when officers do their recertification. Some of it has to do with the availability of training and the fact that officers are dispersed all over the state. Now, there are obviously some technological solutions to that, but to date, we have not been able to get any kind of mandatory program instituted. We will continue to fight on this. We do have a good relationship with the folks at the Arizona Peace Officer Standard and Training Department. They are willing to work with us. They've worked very closely with the Arizona Commission for the Deaf and the Hard of Hearing, and we assume they will continue to be willing to work with us. But in terms of getting more robust training, more mandatory training, we're just going to have to continue that fight. We all agree it's necessary, and even law enforcement officers agree that it's necessary, and they speak out in hopes of getting that training. It's just trying to figure out the proper method to make it happen.
Yes, so thank you so much for that clarification. We have a couple more questions. Jon, someone would like some information on the request to speak system down at the Capitol.
Okay, that probably takes more time than we have right now, but the request to speak system, for those who aren't familiar, is how you can register your support for or your opposition to a particular bill that's being heard in the legislature, either the House or the Senate. It's also a way for you to register to testify in committee. We would be happy to help anybody get registered for that system. If they don't already have an account set up, we can help you through that process. We can also direct you to the folks down at the legislature who can help you get set up in that system. Feel free to contact us. It is a fantastic system that at a minimum allows you, as I said, to register your support for your opposition to a bill. But even more meaningfully, if you wish to go down to the legislature and testify, it lets you sign up to do that. And it gives you a list of every bill that's being heard in a particular committee in a given week, and what's toward the end of the week, what's going to be heard the following week in committee. So contact us. We'll be happy to help you or put you in touch with the right people.
More questions. Thank you. I know we need to wrap up. Actually, let's just do one more question. I learned that undocumented minors are not eligible for DDD, says Kimberly. Is this new? Undocumented miners.
Your day was okay?
Yeah, that is a question that unfortunately I cannot answer. We would have to direct you to DDD, and the Office of Individual and Family Affairs probably there to provide that answer. But again, if you want to contact us, we can give you the appropriate phone number or the appropriate email address to reach out to that office.
Can we order it? Yeah. Okay.
I think that's pretty much it for our questions. Thank you, everybody. I really want to thank you. Please talk amongst yourselves. We'll leave it open for a while. We will be sending out this recording. Any last words, Jon?
Well, once again, we thank you all for joining us today. If there's anything that we've shared that you take issue with, or that you'd like more information about, that if you'd like to join with us in our advocacy efforts, we always welcome members of the community. We are a community-based organization. Our council is made up of representatives from communities all over the state. We welcome your input. We welcome your involvement. The more voices we can bring to bear on issues around IDD, the more success we're going to have in educating our policymakers and and influencing their decisions to support services for people with disabilities in the state. So thanks again for joining us. We look forward to working with you moving forward.